First, with me is Danny Mortimer, the Chief Executive of NHS Employers. Welcome to the Daily Politics. Danny Mortimer, why should working at 9 p.m. on Saturday be classed the same as working at 9 a.m. on a Tuesday morning?
I think the important thing to say is that it might not be. There was a whole standing issues to be agreed with junior doctors and with their representatives in terms of a new contract. And one of them was around working on Saturdays. There are others as well that are equally important. And we are open to discussion about change there.
Is that negotiable then, not working late on Saturdays?
So the working patterns and the expectations we place on junior doctors, and many of them are expected to work as weekends to provide our services. But in terms of how we pay for that, yes, that is negotiable, and that balance of pay in the way in which doctors work is negotiable. The way in which we pay that now, both ourselves and the BMA and the Department of Health feel isn't quite fit for purpose anymore. It was designed a long time ago, and we think there are ways of improving the way in which we pay. And if Saturdays is one of the things that we have to return to and improve, then we're prepared to do that.
But negotiations have broken down. You're not talking to each other, and I'll be speaking to Andrew Collier in just a moment. You walked away, so it sounds like these things were not negotiable. Is this about saving money?
So there's a couple of things. The first is, no, it's not about saving money. Despite the financial challenges that the NHS is under, it has to save £22 billion in the next 5 years. Actually, the approach that's been taken by the government is that the junior doctors' pay bill should remain neutral. So it shouldn't go up, but they aren't expecting to save any money through this exercise. They're expecting to improve the way in which we employ a really key part of our workforce. The second bit to say is that we remain prepared to negotiate and to talk. We're planning to talk directly to junior doctors themselves in the coming weeks, but we're open to having those conversations jointly with the BMA going forward, or indeed to talking to them again.
Right. I mean, do you take the point that all of this has lowered morale amongst an already overstretched staff?
I absolutely am aware of the anger and concern that junior doctors feel about this process. I am also aware, though, of some of the unfortunate examples that are given to them, which I think are scaring them and are causing them concern about what might happen. What I want to be clear about, and I will be clear about from Monday onwards as I meet face-to-face with junior doctors, is that there are really important parts of the contract, like Saturdays, like the overall salary package, that are there to play for and there for us to make some choices about. I can't guarantee that every doctor will benefit from the contract. Some will lose out, some will stay the same, and some will gain.
All right, Danny Mortimer, thank you. And I'll talk now to Dr. Andrew Collier, because you're not engaging with each other at the moment. I should explain that to you. You're sitting here, but you're not engaging with each other, hence I'm interviewing you one after the other. You've just listened to Danny Mortimer. I mean, what is wrong with earning £23,000 as a starting salary?
I think it's really difficult that a junior doctor who's taken 5 years of training at university and has some of the amazing talents that our NHS staff have could work anywhere in the world. And £23,000 is not a bad starting salary by anyone's money, but we're asking these people to make life-changing decisions and work throughout the week, and they are already working 7 days a week.
Right, but in a lot of other industries and a lot of other places of work, evenings and Saturdays are not outside normal working time.
Completely. And junior doctors go into medicine expecting to be able to work Saturdays, Sundays and care for their patients through the week. What this discussion should be about is about the removal of safeguards from the contract. It's about penalising people who take time out to raise their families, and it's about not valuing junior doctors' time, because we know junior doctors are the bedrock of the NHS. That doesn't seem to reflect in the proposals that Danny wants to impose.
Right, I mean, but you've heard what Danny said. These things are negotiable. Why have you walked away from these negotiations? Some of these things could have been talked about, but your actions of walking away make it look as if you are the ones who are trying to hold on to the sort of pay and conditions that you've had for the last 20, 30 years.
It's an extremely fair question. And if in genuine negotiations... But what we were asked to do was participate in an imposition where we designed the finer details. The problem is with the core of this contract. It's toxic, and we've already seen 1,600 doctors just in the last week request a certificate of good standing to go elsewhere. And if we don't look after junior doctors, they'll vote with their feet, they'll go abroad.
But is that because of the scare stories that we've heard from Danny Mortimer? I mean, if the pay is going to remain neutral, you're going to have a higher starting salary, and you will be paid more for those hours outside Saturdays and evenings, unsociable hours through the night, for example. What's the problem?
So throughout the negotiations, we pointed out that the preferred model that was put forward by government was going to penalise some of the hardest working junior doctors. So people working in accident and emergency units would, under the preferred model from NHS Employers, their pay could drop by 10 to 15%. Now, in a cost-neutral envelope, obviously there'll be some winners and there'll be some losers, but should we really be penalising the hardest working members of the junior doctor fraternity? I don't think so.
I'll come to you, Vince, in just a moment. But Danny Mortimer, toxic negotiations is what we've heard from Dr. Andrew Collier, and this risk of an exodus of junior doctors is going to leave the NHS in a dreadful situation.
So the NHS isn't interested in having a contract that forces any of our employees to go and work elsewhere, whether that's abroad or cross over into Scotland and Wales that are taking a different path. What we want is a fair settlement, and there will be some choices to be made, and it is very difficult to square some of those choices through the very different ways in which doctors work. But that still remains our preference, is to work with preferably the BMA, and if not the BMA, with other junior doctors, to reach settlement that actually updates the way in which we pay and reward this really important group of our people.
Where do you stand on this, Vince Cable?
Well, we need a 24/7 NHS. I mean, people can't time their illnesses for the traditional working week, so you need all round the clock. Obviously, pay and conditions have got to reflect that.
Do you have any sympathy for Andrew Collier?
Well, I was amazed to discover the starting salary is as low as it is. I mean, this is actually, you know, in the jargon, the median income, and I'd have thought that after prolonged training we would be starting at a significantly higher level. But I mean, I'm actually surprised on this programme to discover they start as low as they do. Yeah.
Would you be prepared to go out on strike?
I think it's not something no junior doctor wants to do, but when doctors feel backed into a corner, they're left with very little option.
Gentlemen, thank you.
Thank you.
So, the